radiotherapies at Narayan Health, Dharamshila. And we are fortunate to have her today as our guest speaker on the special month for the, as rightly said by her, that this is the Pink Month, and we are celebrating a breast cancer awareness month throughout the country and across NTPC also. And this is the right forum to discuss about breast cancer, its awareness, early detection, risk factors, and also its modalities of therapy for breast cancer. So we have today with us Dr. Kanika Sharma Sood, who is the Director and Clinical Lead Radiation Oncology at Dharamshila Narayan Super Specialty Hospital, Delhi. She has a vast experience of more than 15 years in teletherapy, treatment planning, brachytherapy, and any terminologies that I fail to understand also. Monaco, Zio, Eclipse, Plateau, and Asha. And she has affiliation of many professional organizations like DMC, PMC, and Association of Radiation Oncologists of India, Society of Oncology, Oncology Forum, and many more. And she has got many more publications on to her credit in scientific literature. So I think we take this opportunity to listen to her about the special topic on breast cancer. So I request Dr. Kanika to please start the talk. Thank you. The stage is yours now.
Thank you so much for the kind introduction, sir. A very elaborate introduction. Thank you. So basically, as you've already rightly put up, that Breast Cancer Awareness Month is being observed in October. And we know it is a disease which is very common, but special efforts have to be made to make people aware of its signs and symptoms. Most of us know a little bit about cancer, but somehow the information which people have is not scientifically validated, and it is more of information rather than knowledge. So we observe these months so that we can draw attention towards these particular problems which are on a rise. And why do we actually want to talk about it? We want to talk about it because cancer is increasing so much that almost everyone is touched by cancer. There may be a family member, a relative, or somebody who's affected by it. It could also be that in your own body, cancer cells are developing. कुछ cells बन रहे हैं, but your own body is fighting. हम सबकी body में कुछ check mechanisms होते हैं, उनको हम कहते हैं immune checkpoints. कुछ policemen होते हैं, tumor suppressor genes होते हैं, जो tumors को बनने नहीं देते. However, in patients who are more prone to cancers, these checkpoint inhibitors or these tumor suppressor genes are defective. So cancer develops. So cancer cells सब में बनते हैं, पर वो लोग जो इम्यूनिटी जिनकी कम है या उनकी बॉडी में कुछ डिफेक्ट है इम्यूनिटी का, उसकी वजह से वो उस सेल्स को लड़ नहीं पाते हैं और वो बढ़ने लगते हैं. सो दैट इज व्हाई वी शुड नो अबाउट कैंसर. एंड कैंसर समहाउ हैज बिकम अ लीडिंग कॉज ऑफ डेथ. जो 3 मुख्य कारण हैं डेथ के, हार्ट डिजीज, एक्सीडेंट्स और कैंसर. कैंसर के लिए इसीलिए हमें अटेंशन देना जरूरी है. एंड देन इट इज अ प्रिवेंटेबल कॉज. दैट इज व्हाई वी वांट टू टॉक अबाउट it. And we see that in our country, we are leading in the number of cancers for cervix, gallbladder, oral cavity, and pharynx. So this is worrisome. And the most alarming situation is that most patients who come to the doctor, they come when 80% chances are that recovery will not take place, or they come when the chances are that 70% might die in the first year itself because of late detection. और सबसे बड़ी बात है, ये जो फैक्टर सबसे राइट साइड पे दिख रहा है कि वर्ल्ड वाइड सिर्फ 0.5% बच्चों को कैंसर होता है, बट हमारी कंट्री में 15% कैंसर्स बच्चों को होते हैं. बच्चों में 15% कैंसर होता है. सो दीज आर अलार्मिंग फिगर्स. एंड कैंसर डज नॉट डिस्क्रिमिनेट. किसी को भी हो सकता है, बच्चा, बूढ़ा, स्त्री, पुरुष. अगर हम ब्रेस्ट कैंसर की भी बात करें तो ये भी दोनों जेंडर्स में हो सकता है. बट क्यों हो रहा है? बेसिकली व्हाट इज द कॉज, व्हाई इट इज ऑन अ राइज? The biggest reason is urbanization. जो हमारा western lifestyle है, that is considered to be the biggest reason of increasing cancers in our country. Especially जो एज है जिसपे कैंसर हो रहे हैं. आपने पिछली स्लाइड में भी मैंने दिखाया कि हिंदुस्तान में लगभग 70% लोगों को कैंसर होता है 70 साल से कम की आयु में. Whereas in the western world, more people die after the age of 70 years. So in our country, younger are being affected more as compared to the Western world. If you look at the total figure per year, almost 14.5 lakh new cases of cancers are reported in our country, of which around one third are because of tobacco consumption. And everything is not that bad. The cases are increasing. There are betterment in our treatment technology. We have targeted treatments. We have sophisticated medications. So survivals are increasing. At the same time, there is a better detection and awareness, which is leading to better treatment modality availability. So to understand breast cancer, first you need to understand what is cancer. So cancer happens when a normal cell, which should have divided into two, divides uncontrollably. And why does that happen? Because the cell DNA has some genetic defect or some defect in repair, where it does not understand whether the cell is normal or abnormal. So the abnormal cells, they do not have a programmed cell death and they keep growing uncontrollably. And these cells, they are useless to the body. ये किसी काम नहीं आते. They try to destroy the areas around, जैसे कि नसें हैं, धमनियां हैं, उनको destroy करके they can spread to the other parts of the body as well. The major factors which cause cancer are consumption of tobacco and alcohol, some infections, unbalanced diet. खासकर breast cancer में unbalanced diet, too many carbohydrates, lot of calories, obesity, lack of physical activity is one of the causes. And in addition, use of hormones, hormone replacement therapies ले रहे हैं, that can also increase the risk of cancer. Genetic causes overall are just 2%. But breast cancer may up to 8 to 10% cancers can be attributed due to genetics. So understanding few symptoms, if you understand the symptoms of breast cancer, first you need to understand the risk factors. The risks primarily are those ladies जिनके कोई बच्चे नहीं हैं या पहला बच्चा 30 साल की आयु से ऊपर हुआ है, उनके पीरियड्स बहुत जल्दी स्टार्ट हुए हैं, पीरियड्स बहुत लेट तक चले हैं, लेट मेनोपॉज, या उन्होंने ये हार्मोन रिप्लेसमेंट कर दिया. Lifestyle, जैसे मैंने पहले भी बताया, tobacco, alcohol का consumption, obesity, all these factors predispose to breast cancer. And breast cancer more so happens in women who are more than 40 years of age. महिलाओं के अलावा 1% केसेस पुरुषों में भी ब्रेस्ट कैंसर के हो सकते हैं, but men should also be aware of this. सिम्टम्स में प्राइमरीली कोई लंप, गांठ, खासकर शुरुआत में उसमें दर्द नहीं होता है, निपल से डिस्चार्ज, बगल से या गले के पीछे लंप, निपल का सिकुड़ना, छाती की चमड़ी में अल्सर बन जाना, these can be the major symptoms. As you can see, कोई भी गांठ, निपल से खून भरा डिस्चार्ज, चमड़ी में लालगी जो कि ठीक नहीं हो रही है, रैश जो ठीक नहीं हो रहा, these can be symptoms of breast cancer. But मैं यहाँ पे एक reassurance भी देना चाहूँगी. I would say that all cancers do not manifest as lumps, and all lumps may not be cancer. Many times women have other lumps also, like fibroadenomas, breast abscess, fat necrosis, which can also feel like lumps. So one should not fear. One should go to the doctor who can see, check, and find out whether you have cancer or not. The best thing a woman can do is she can go for screening. स्क्रीनिंग का मतलब है वो व्यक्ति जिसको कोई भी तकलीफ नहीं है, वो हॉस्पिटल जाके अपनी कुछ जांचें कराए छुपी हुई बीमारियों को देखने के लिए. सो अ पर्सन शुड गो फॉर अ स्क्रीनिंग. हाउ स्क्रीनिंग इज डन? हेल्थ स्क्रीनिंग कैन पिक अप डिजीजेस अर्ली, and there are very good tests for screening for cervix, breast, and particularly I will talk of breast cancer. In this screening, the doctor will examine you, physical examination होगा, might order some blood test if required, but majorly एक imaging process किया जाता है, which we call as a mammography. And in those cases where we find that there are some higher cases of breast cancer, ovary cancer, colon and pancreatic cancer in your family, we may order some genetic test. Breast cancer के लिए mammography is the best modality for screening. It should start at 45 years of age. 45 years की एज से 54 years तक हर साल mammography कराना चाहिए. After 54, it can be reduced to once in 2 years, and till the time we feel that a woman has at least 10 years of more life, it should be continued. Mammography के अलावा एक सालाना क्लिनिकल एग्जामिनेशन किसी भी डॉक्टर द्वारा अंतस्त्राव की जांच होनी चाहिए, सो दैट आपको अगर नहीं पता चल पा रहा है या मैमोग्राफी आप मिस कर रहे हैं, तो एटलीस्ट डॉक्टर आपसे एग्जामिनेशन करके पता लगा सकता है दैट देयर इज नो हिडन कैंसर. Third thing which can be done is self-breast examination. And self-breast examination is where a woman herself examines her once in a month, 4 to 5 days after her periods have commenced, from the age of 18 years. और उसमें महिला खुद अपनी स्तन की जांच से पता लगा सकती है कि कोई नई कोई गांठ तो नहीं बनी. तो उसमें आपको कॉलर बोन से लेके आपके पेट तक और बगल से लेके ऑलमोस्ट छाती के बीच तक पूरे छाती को फिंगर्स के फ्लैट सरफेस से दबा के देखना है कि कहीं कोई गांठ तो नहीं। सो आपको अपने रिस्क खुद भी पता चल जाते हैं। अगर आप ये एक्सरसाइज मेरे साथ करेंगे, यू विल नो वेदर यू आर एट रिस्क। So who is at risk? People who are more than 40 years of age are at risk. If you are obese for your height, आपका BMI इंडेक्स जो है वो 25 से ऊपर है तो रिस्क ज़्यादा है। ऑक्यूपेशन वाइज आपका सेडेंट्री लाइफस्टाइल है, आप एक्सरसाइज नहीं करते हैं, पेट कम खाता है, then you are at a higher risk for developing cancers, particularly breast cancer. And on that, if you are consuming all these products like alcohol, cigarette, bidi, pan, tobacco, your risks are badly high. And consumption of uh, green colored fruits and vegetables are protected. If you are taking fruits and vegetables in your diet, lot of fiber, vitamins, then you are protected from cancer. Biggest culprit in our country remains to be tobacco. Women also consume tobacco, and it is something which is not unusual. We see youngsters in the malls, using these hookahs and these tobacco products. So all this is going to increase the incidence of cancer in our country tremendously. जो आंकड़े बताते हैं, जो प्रेडिक्शन हैं ग्लोबल वो ये है कि अगले 10 साल में 50 साल से कम उम्र के लोगों में जो ओवरऑल कैंसर है अराउंड 43% बढ़ेगा, और कैंसर से मरने के चांसेस भी 50 ईयर्स से कम की एज में ऑलमोस्ट 23% बढ़ेंगे. सो दैट इज दी बैड सिचुएशन. सो the 7 tips I can give you to prevent cancer are: firstly, do not smoke. Any form of tobacco is bad. Bidi, gutta, sukari, hukka, all are bad. Maintain a healthy body weight. A body mass index 18 to 25 is good. All of us have smartphones. You can very well, calculate, put your data into that, and you can calculate your BMI. And 18 to 25 is considered non-obese. 20 से ऊपर आप overweight होते हैं, but we don't call you obese. So maintain a healthy body weight. Eat at least 5 to 7 colored fruits and vegetables in your diet. Resort to some exercise. Limit alcohol. Protect yourself against sun for skin diseases, skin cancer, and फॉलो द स्क्रीनिंग रिकमेंडेशन बताएंगे कि हर साल आपको 45 साल की उम्र के बाद सालाना एक मैमोग्राफी करानी है 54 ईयर्स तक. आफ्टर दैट once in 2 years. So if you are following all this, the risks of getting cancer are reduced and chances of picking it up early are there. So if a message I can give you is, firstly is that do not think I am immune to cancer. सबसे बड़ा भ्रम हम ये पालते हैं कि कैंसर सिर्फ औरों को हो सकता है. We cannot get cancer because nobody in our family has. As I told you, genetic component is very low. Breast cancer, only 8% cases are genetic. So 92% cases are not genetic. So do not think you are immune, and do not panic. God forbid, if something you detect in your body, do not panic, do not run for alternative medications. Go to a proper hospital, to a doctor who can diagnose and treat it in time. Cancer nowadays is not incurable. It is just that people come to us in very late stages. If somebody comes in stage 1, 90% chances that patient will be cured. If somebody comes in stage 2, almost 60-70% chances of cure. But in stage 4, the cure rates become less than 5%. So it is the timely treatment which is important. So be involved, participate in screenings. Prevention is the best medicine one has in today's time. And resort to healthy behaviors. So I would be happy to take a few questions. Over to the organizers.
Thank you, Dr. Karikar. I would like to request the audience, if they have any questions, they can ask them in the chat box so that I can read it out for you. Ma'am, I have a question regarding the screening of breast cancer. Apart from mammography and ultrasound breast and the self-breast examination, nowadays many initial startups are coming up with a thermo imaging or infrared imaging or some sort of. They're coming with a device and they are saying that we are using AI and they can predict your breast cancer or they can diagnose early breast cancer. So how far they are scientifically prudent? We are not able to find any documents with support of those things.
Your concern is absolutely correct, sir. They have been approaching all of us, all of the oncologists are being approached by these firms to start using them in our clinic, but they are not scientifically validated. So we still are not having enough information. We do not know whether their sensitivity and specificity is good enough to be put in practice. So till the time we have FDA approvals and we have a proper study which has been conducted where they compare it with the currently used screening modalities, we are not adopting it. As a protocol, maybe we can use it as an adjunct to what we are doing to find out how much collaboration, they are collaborating with our mammography. But as of now, none of the breast surgeons or the oncologists are using it into practice.
We have a question: how frequently should one screen for breast cancer?
So self-breast examination, every woman who's more than 18 years of age should go for a monthly self-breast examination. Clinical examination once in a year. Mammography, if there is somebody having a genetic history, the genetic history patients, the patient who was the first diagnosed in your family, उसकी एज से 5 years पहले स्टार्ट करना है. Rest others should start at 45. 45 is the ideal age. 45 to 54 years.
I'm late first child. Up to what age is a risk factor for breast cancer?
So 30 years is considered childbirth above 30 years is a late childbirth. We call it an elderly primary. But anything below 30 is considered now.
Anyone? Any more questions? What is Oncotype DX test and what is the use of this test?
So Oncotype DX is a gene analysis. It is a genomic analysis which we conduct for early breast cancer patients. These are patients who have disease and we want to decide whether if the tumor is so small that we can forgo chemotherapy. We want to identify a low-risk patient where we just want to treat with hormone and do not do any chemotherapy. That is Oncotype DX.
Okay, ma'am, you told that we need to protect ourselves from sunlight. It is essential for vitamin D synthesis and boosting immunity. So how can we expose ourselves to proper vitamin D?
So as you might have noticed, of late, sun exposure is not contributing to much of vitamin D production because it is said 10 to 1 o'clock is the time when skin, makes good amount of vitamin D, and that is our working hours. It is the harsh sunlight which is happening in areas like Australia where you are closer to the beaches or you are having exposure at mountain area very close to the sun. These are dangerous. We are talking of these harsh sunrise. We are not talking of the normal sun rays which are, people go out for sunbathing. That is fine. The harsh sun rays are the ones which are damaging and can cause skin cancer.
One more question is, tell us the benefits of HPV vaccine.
Pardon? Sir, I cannot hear.
Tell us the benefits of HPV vaccine.
So HPV is not for breast; it is for cervix cancer because cervix cancer is cause of human papilloma virus. There are 8 different viruses which can cause cervical cancer. So this vaccine is against those viruses and it protects against cervical cancer. It has no bearing in breast cancer.
Does hormone receptors positive tumor respond better?
Yes, of course. Hormone receptors give you an additional target to treat, and they tend to be slow growing compared to the ones which are hormone negative.
The role of MRI and ultrasound or sonomammography in screening.
Pardon?
What is the role of MRI, ultrasound, or sonomammography in screening?
Okay. So if a lady has an ACR breast of D where there is a fibrous tissue, we cannot pick up disease on a simple mammogram. That is the situation where we might do an MRI. We might do an MRI to find multifocal disease. We might want to do an MRI in patients who are BRCA positive. These are the indications where we do an MRI. Rest all MRI is considered to be an overview. We do not prefer to do MRI. It's a costly investigation and sometimes leads to unnecessary alarm because of finding a lot of false positive diseases. So I'll have to leave, sir. My second talk is sorry, I will be now just winding up.
Thank you so much. Thank you very much.
Okay, thank you.